I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're going to talk about today is how do you know if your immune system is not working properly? Now, we've done a lot of shows with the disease conditions and autoimmune diseases and COVID, of course, but I never really thought about putting together a show that would say these are signs and symptoms that your immune system needs some attention, needs some TLC. So we're going to talk about that today, and surprisingly, a lot of you are going to say, oh my gosh, I have that. So these may be minor signs of immune issues before they show up as anything else. So that's what we want to talk about today is, do you have these symptoms? They could be signs of immune system issues, and then what do we do about it? And then the second half, we're going to talk about signs and symptoms that muscle pain is something more than just muscle pain. Because I have patients come in every single day, and I've been doing this for almost 37 years now. And they say, well, Dr. Joe, it's no big deal. It's just a pulled muscle. I just hurt my back working out. I'm just tight. Well, not necessarily. It could be something more than that. So let's jump right in. Got a lot to cover today. So immune system, what it does, it should fight off disease and keep your body healthy. But if your immune system can be weak, it can be underactive, it can be overactive, it can even attack your own body by mistake. That's called autoimmune. Immune system problems can cause things like allergic reactions, persistent illnesses, and could even kill you. So it's really important that this immune system stays in what we call the Goldilocks zone, right in the middle of where it should be, between it's not too much, it's not too little. You want the immune system just right. So a couple of symptoms and signs. If you have these, we're going to talk about what to do about it. How about dry eyes, or like your eyes feel like they have grit in them? Very dry eyes can be a sign of immune system problems. There's something called Sjogren syndrome. Now, if you've ever seen it spelled, it's Sjogren. It's pronounced Sjogren. And your immune system dries up the tears that keeps your eyes moist. So dry eyes could be a sign of Sjogren syndrome. If your eyes are dry, red, it may feel like you have grit in them or sand in them. You might even develop blurry vision and even have cornea damage. So that's something you want to look at. And if you have this condition, it's an autoimmune disease. Now, if you go to our website, drjoe.com, you can type in autoimmunity. We did a whole show on how to deal with that. This is kind of like an extension of that show. But so many people have autoimmune conditions, and they don't know what to do about them. And I see it every single day in my practice. I see somebody, I promise you, somebody's going to have at least one, many days, multiple people with autoimmune diseases, and they don't know what to do about it. One of the treatments is, and again, I'm not saying this is the wrong treatment, but one treatment that's accepted is we give you something to shut down your immune system. We give you steroids. And the steroids shut down your immune system, but then there's a problem because you need your immune system. Because what does the immune system do? It fights off disease. So that might work in emergency situations, and I'm not saying don't do that, but what I'd like to do is get to the cause of the problem, not just treat the symptoms. And I'm okay treating symptoms. We have a medical division in our office, so we can do trigger point injections, we can do spinal injections, nerve ablations, nerve blocks. So we can do all that. When people are in pain, you have one goal: get out of pain. That's all you really care about. But once the pain is under control and managed, then we want to get to the cause of the problem. So I want you to consider that as well. So again, we're talking today about signs and symptoms of a weak immune system. Sometimes you don't know you have it, and you want to fix it before it gets too bad. How about depression? Depression can be a sign of immune system problems. A faulty immune system can send inflammatory cells, they're called cytokines. We've talked about these in the past. Cytokine are inflammatory cells that can go into your brain. That lowers the levels of chemicals like serotonin, and serotonin is your happy neurotransmitter. The good news, exercise can boost serotonin, lessen inflammation, and can even ease the signs of depression. But again, we got to get to the cause of the problem, not just treat the symptoms. And I've covered this in so many shows, and if you're new to the show, I want to cover it for you specifically. Every case I've ever had where there's an emotional issue, anxiety, depression, bipolar, ADD, ADHD, every single case I've ever seen, I've seen thousands, I may even venture to say tens of thousands, there's always an undiagnosed or misdiagnosed digestive condition. because your stomach has to break down proteins into something called amino acids. The amino acid tryptophan becomes serotonin in your brain. So if you have acid reflux, heartburn, burping, gas, bloating, many times you're not breaking down proteins properly, you're not getting amino acids, the amino acids become neurotransmitters, and your brain can't work. And if your brain can't work, that comes up as a symptom, an emotional disorder. So if we fix the gut, in a lot of cases, we fix the brain. And so that's something I wish was covered more. It's well documented in all the journals, but it's not something that's really hit mainstream yet. So if you've listened to the show for a long time, and I've been lecturing now for over 40 years, I talk about things that become mainstream later on. So I want you to think about that. What you're learning today is going to become mainstream 2 years, 5 years, 10 years from now. So you're way ahead of the curve by listening to these shows. And if you like the show, by the way, if you're a podcast junkie, go to your podcast service and type in Dr. Joe for the health of it. And that's our podcast on all the podcast services. And on our website, drjoe.com, we have over 1,500 hours of podcasts, audio and video. Podcast service, you just have audio. On our site, we have audio and video. YouTube has it too, at Dr. Joe Esposito. So there's lots of ways to get this information. So if you like listening to this, we got lots more for you. Many times skin rashes can be a sign of immune issues or autoimmune issues. Sometimes eczema is a sign that your immune system is overactive. Psoriasis, psoriatic arthritis, and diseases linked to the immune system all go back to trying to get the immune system normalized. Your immune system attacks its own cells in the skin and it causes inflammation. So you might have red, flaky skin, blotchy plaques. That's the immune system attacking itself. What I find with that is we need to treat the liver. Whenever I see these eczema, psoriasis conditions, almost always it goes back to liver, which again is connected to what? Your immune system. So it all ties together. Nothing is independent in the body. And so we want to get the body healthy. And with liver, we got to fix the gut. Because the gut digests food, passes it into the blood system filters it through the liver, and then the liver has to pass it out. So whenever I see liver issues, I always want to look at the gut as well. So of course, alcohol and sugar can damage the liver, drugs can damage the liver, stress can damage the liver, circulatory issues can damage the liver. So supplement-wise, I always recommend Super Greens and Essential Source, and that's kind of the core supplement. It's not kind of, it is. The core supplements that I recommend for almost everybody. So Super Greens and Essential Source, I take a scoop of it every day, a scoop of each every day. I ran out of coconut milk this morning. I just mixed it with water. It tasted fine. I usually use coconut milk or almond milk, so I didn't have any milk in my house today. Just used a little cold water. Tasted great. And then for the liver, we have something called glutathione. Glutathione is the master antioxidant. It helps protect the body and break down free radicals or prevent free radicals from causing damage. So glutathione is a key player in the immune system. And when people ask me, Dr. Joe, what do I take for my immune system? My immune protocol is Super Greens and Essential Source, glutathione, probiotics, and vitamin D. That's the protocol I take every day. Haven't been sick in years. So far, so good. So Super Greens, Essential Source, glutathione, probiotics, vitamin D. That's my protocol for the immune system. And that can help stabilize the immune system. You don't want to stimulate. Sometimes the immune system is overstimulated. You want to downregulate it. So we're talking today about symptoms you may have that are signs that the immune system isn't working properly. Stomach and bowel issues almost always go along with immune system issues. Diarrhea, belly pain, bloating, weight loss could be symptoms of things like Crohn's disease, colitis, irritable bowel syndrome, ulcerative colitis, celiac. Celiac is when you can't eat gluten. And I had somebody just the other day send me a question on the website, drjoe.com, and she said, did she call me? I think she might have called me. And I was telling her, first thing you want to do is give up all wheat, all gluten, which is wheat, barley, and rye, and all meat and dairy products. And she said, I don't want to hear you tell me that I have to give up wheat. I don't want to do that. And I said, okay, you have every right not to do that. You asked me my opinion. My opinion is give up wheat and dairy. So we talked a little bit more, and I said, here's my challenge to you. I want you to give up wheat and dairy for 2 weeks. 2 weeks. No wheat, no dairy. Not a bite, not a nibble, nothing. No wheat, no dairy for 2 weeks. At the end of 2 weeks, I want you to have a couple of slices of pizza, which is wheat and dairy. And I negotiated with her, and she said yes. So I was very happy she said that, because in 2 weeks, she's going to see a big difference. And then when she comes back on to wheat and dairy, she'll see a difference again, and she'll know that Dr. Joe was right, because Dr. Joe is almost always right. Not always, but almost always. So we're talking about symptoms that may be signs that your immune system is not working as well as it should. So digestion is always a big player when it comes to the immune system. Cold hands and cold feet. Sometimes they turn white or blue. That's called Raynaud's. It used to be called Raynaud's phenomenon. For some reason, somebody smarter than me changed it to Raynaud's disease. And Raynaud's disease is blood flow to the hands and feet may be slow, and it slows down when it's cold temperatures. And many times people can get burning in their hands and it hurts, and it's so cold you touch them, it's like touching ice. It's an autoimmune condition. Hands and feet could mean thyroid gland is underactive. That could be due to your immune system issues. It could also be due to pinched nerves. Now, as a chiropractor and an orthopedist and a pain management specialist and a nutrition expert, many times I find when people have hand issues, numbness, tingling, pain, it's a pinched nerve in the neck. And when they have foot issues, leg issues, numbness, tingling, cramping, it's a pinched nerve in the low back. And every day we see patients with these pinched nerves, and when we give them good quality chiropractic adjustments, it opens up the nerve supply into the hands and feet, and in many cases they get miraculous results. And so they're really happy with that. Now, here's the thing with diagnostics. When we diagnose a patient, I always teach my interns this and my students that you're a detective. You're going to get a few clues and you got to solve the crime or solve the problem. And so pinched nerve is always my go-to when it comes to most conditions, because almost all conditions have a pinched nerve associated. It may not be the only cause, but it's one of the major causes. Fix that and a lot of conditions go away. Then we look at the diet. What are you eating? Maybe it's headaches. Well, caffeine can give you headaches. Dehydration can give you headaches. Monosodium glutamate can give you headaches. So we fix the structural. We look at the diet. We try to figure out if there's a dietary component, and many times there is. And then we say, what kind of supplements does this person need? And the minimum supplements, of course, and folks, if you're not doing it, I don't know why you're not. Super Green's an essential source. They're 2 powders. They taste great. They're on the website, drjoe.com. You can order them or pick them up. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. So if you want to come pick them up, great. Save yourself some shipping. But with cold hands and cold feet, sometimes I'll recommend nitric oxide. Nitric oxide is a supplement. I take it every day, and it opens up your blood vessels. Now, I can't tell you how many patients use this as a tool because they may use it for romance, open up blood supply for men and women. A lot of people use it before a workout. One of my doctors, as a matter of fact, said, Doc, I wake up, I take 4 nitric oxides, and I do this amazing workout. He's in amazing shape. So it's that boost of energy without caffeine. Caffeine has negative side effects to give you energy. Nitric oxide has usually positive side effects to give you energy. So I can't take 4 at a time. I get real anxious. He can take 4. But I have to take 2, and then I take 1 or 2 later on in the day. I have to spread mine out. But try it. See how you work. But the nitric oxide is amazing for opening up circulation, which can help so many different problems. Another sign that you may have immune issues is hair loss. Your immune system can attack the hair and damage it, causing what's called alopecia, and that's also called hair loss. Hair may fall out in small patches on your head or elsewhere in your body. You might have small patches on your chest if you're a man, on your head. And so if it falls out in small patches, that's called alopecia. Other immune system problems like plaque psoriasis on your scalp can cause patchy hair loss as well. Sun sensitivity. Immune system problems can make you very sensitive to the sun. If you have lupus, your skin can burn very easily. So be careful there. Now, I want to talk about, because I got a lot more to cover, I'm not going to have enough time, is what to do about the immune system. Again, I want you to give up all wheat and all dairy products. Those are the 2 foods that just blow up your immune system. So take out the wheat and the dairy. Many times that solves the problem. You got to make sure that you're getting enough vitamin D. So many people don't get enough vitamin D. And vitamin D is free if you're out in the sun for 10 to 20 minutes at least 3 or 4 times a week. And it's not winter. Even in the winter, you're not going to get enough vitamin D even if you're out in the sun. So we can do a blood work in our office. We do blood work. We have medical as well as chiropractic in our office. And we can test your vitamin D, or I just take 5 drops of vitamin D every day just to make sure. Now, you can overdose on vitamin D, so don't get too much of it. You can't overdose with vitamin D from the sun. You can overdose as a supplement, so just be careful with that. But we can test your levels, and we want to get you, normal is about 30 nanograms per milliliter. I like to get about 60 to 80 nanograms per milliliter. even when COVID came out, and throughout COVID, I always talked about if you can keep your vitamin D around 60 to 80 nanograms per milliliter, you reduce dramatically the risk of getting COVID. Quick, easy, simple, cheap. It's just not talked about. Now, I'm not saying you're not going to get COVID or any other disease. I'm saying you're reducing your risk of it. So getting the immune system working is controlled by what? The nervous system. So if you have a pinched nerve, you might have pain. Let's say neck pain, back pain, shoulder pain. But here's the thing. 90% of your nerves don't feel pain. You can have a pinched nerve and not know it. So in our offices, all our doctors are trained to test the nerves that feel pain and test the nerves that don't feel pain. Because there are many studies done, and some of them are at Life University in Marietta, Georgia, on the immune system and chiropractic. And chiropractic can help regulate, that's the key word, regulate the immune system. And so that's why chiropractic should be part of your protocol if you have neck pain, back pain, shoulder pain, but also if you're worried about staying healthy. Chiropractic is a lot more than just pain. That's just a small portion of what we treat. But keeping healthy is going to be the key here. Today we're talking about the immune system. So if you do have a health issue, you want to make an appointment to come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctor. So if you want to make an appointment, you can do it right online, drjoe.com, drjoe.com. That's our website. You can order supplements there. You could listen to free podcasts, audio and video. We have articles. If you have questions, you could send them to me through the website, drjoe.com. I'm more than happy to answer them for you. A little bot pops up and says, hey, would you like to chat? That's us. That's a bot. It's not us directly. But you can type in your question. We'll get back to you as soon as we possibly can. So make sure you give us your email address or else we can't get back to you. So if you want to make an appointment, if you want to get well, normally the first visit is $375. We've reduced that to $199. That's an exam, x-rays, consultation, going over the x-rays on your next visit, a nutritional evaluation, and your first treatment. So if you're serious about wanting to get well, I think you really need to get on that right away. Okay, drjoe.com. And we accept insurances. So that's even nice too. We file insurance for you. And if you've ever been in a car accident, if the car was damaged, you were damaged. You want to come see us right away. I cannot stress car accident enough to get in to see us right away. So you can do all of that on the website, drjoe.com. Other signs that you might have an autoimmune disease or immune system isn't working. Joint pain. Suddenly painful swollen joints can be caused by something called rheumatoid arthritis. Rheumatoid arthritis, your immune system inflames the tissue surrounding your joints. And that becomes a real serious issue. Rheumatoid arthritis, I am begging you people, please, if you have any autoimmune condition whatsoever, I cannot stress this enough, please give up your wheat, give up your dairy. See what happens. If I'm wrong, I'm wrong. I lied to you. I'm not lying to you. Give it a shot and see what happens. I think you're going to be very, very impressed on what happens when you get the immune system working. Now, with rheumatoid arthritis, it's called RA sometimes, we can take blood work and test for that, looking for what's called the RA factor. But with rheumatoid arthritis, the joints inflame, and when they inflame, they move out of place. And when a joint moves out of place, it pinches nerves and cuts off blood supply, which then can cause more of an inflammatory reaction. So with rheumatoid arthritis, many times you're caught in a cycle. You can't get out of this cycle because you have a pinched nerve, which causes an inflammatory reaction, which causes an autoimmune disease reaction, which causes more inflammation. And so rheumatoid arthritis is many times so easy to manage if you understand what to do about it. You want to realign all the joints so that as they heal straight. You want to cut out the big triggers. The two big triggers are going to be wheat and dairy products. You want to stabilize the immune system. Supergreens, Essential Source, nitric probiotics, vitamin D, and glutathione. That's what I take. And if I knew any other things to take, I'd tell you to take them too. Now, you can always check with your doctors. But here's the thing. A lot of times doctors are not trained in nutrition. They send their patients to us because we're the experts in nutrition. So if the doctor doesn't have a lot of training in nutrition, you might want to defer to somebody who is an expert in that field, like my doctors and myself, and work together with your doctor. I'm not saying stop seeing your doctors. I'm saying let's work together to try to get the patient the best care possible. Sometimes you need steroids. Sometimes you need painkillers. Sometimes you need injections. We can prescribe them in our office. Our medical staff can, but we try not to if we can avoid it. If we can't avoid it, then we have to do it. So rheumatoid arthritis, again, autoimmune disease. Graves' disease, thyroid conditions, Hashimoto's, autoimmune diseases. Celiac, irritable bowel syndrome, many times an autoimmune disease. And that can lead to things like depression, high blood pressure, And so treating the symptoms is one thing, but getting to the cause is always our goal. And I want it to be your goal too, because it just, makes sense. Makes sense to treat the cause. You don't have to treat the symptoms. Other signs that your immune system might be weak. Wounds heal slowly. If your immune system is sluggish, minor wounds like a cut, a burn, a scrape can take a long time to heal. A healthy immune system reacts quickly and the body heals quickly. So the better you get your immune system, the better off you're going to be as far as healing wounds as well. And the most common one, of course, you get sick all the time. How many people do you know? They go from one cold to another cold to another cold. When I was younger, before I knew what I know now, I would get sick constantly. I hated winter. I had a sore throat all day, every day in the winter. I had a runny nose. I'd come out of it. I'd get another one the next week, having no idea that I was causing most of it. I ate a lot of junk food. I ate wheat and dairy. I was Italian, half German, ate a lot of sweets, a lot of breads, cookies, cakes, donuts, pastas. I was just destroying my immune system. And I dreaded winter because I had a constant sore throat. And I tried everything. I tried natural stuff. I tried over-the-counter stuff. I tried everything I could to get rid of this sore throat, and it was miserable. When I finally realized I was causing a lot of the weakness of my immune system, stopped doing it. Got better, realized I was right, and that's why I can share this wisdom with you. And then, of course, supplement-wise, Super Green's an essential source. If you do get a sore throat or a scratchy throat, I want you to have on hand zinc lozenges. Don't take it as a supplement, just take it as a lozenge, because when you suck on a lozenge, as the zinc runs down your throat, the zinc can bind to the virus and prevent it from replicating. And that's why zinc is so effective in viral infections, because it actually binds to it. But it has to come in contact with the virus. That's why sucking on a lozenge is much more valuable than taking it internally. And you should get zinc. If you're eating a good plant-based diet, you're getting plenty of zinc. You're eating even meat, you're getting zinc. But you got to let it run down your throat. And fatigue. I can't tell you how many patients come to see us, they're just wiped out. So fatigue is when you're exhausted, you can't even walk across the room. You're not only just tired, that's severe fatigue. Overactive immune system can trigger inflammation that can lead to severe fatigue and tiredness. So if you have that, start to think, am I sleeping enough? Am I eating the right foods? Am I getting chiropractic care? If you're doing all those things, then we have to start thinking about, okay, this might actually be an autoimmune condition. And then what do we do about it? And again, the simplest thing you can do, start out easy if you're not ready to jump in with both feet. Cut out the wheat and the dairy. See what happens. Doesn't work? Like I said, it's free. It doesn't work, but it'll work. And then we start adding the supplements, the Super Greens, the essential source, the glutathione, the probiotics, the vitamin D. And let's keep the immune system strong. And then if we need to, we can always do a blood work on you in our office. We have a medical staff that can do blood work on you. And we also have a test for food allergies. And if you, I've done the test before, and it's amazingly accurate, but we can do a food allergy test and find out if there's any foods that might be triggering an inflammatory reaction, which can adversely affect your immune system. So if you don't know what to do, you're not sure, how, you want to get exact numbers or exact foods and recommendations, just call our office. We can set you up a time to have a food allergy test done, and we can find out exactly what's going on. Had a patient come in the other day. He wanted a hair analysis, and he wanted a food allergy test. He said, I've heard about these things. People have done them, have totally changed their lives. He says, I want you to do them. I said, okay. So hair analysis is really easy. Take a little bit of hair out off anywhere in the body, very, very minor amount, and we send it into the lab at the company, and they do an analysis for you. And the main thing we're looking for with hair analysis is heavy metal toxicity. So mercury, lead, chromium. So if you have heavy metal toxicity, that can blow out your immune system as well. If you want to make an appointment to come see us, or you want to get the supplements, go to our website, drjoe.com. Should you do it? Yes. Now, what are you waiting for? Stop suffering needlessly. I'm Dr. Joe Esposito. Tell your friends about the show, drjoe.com. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.